Now back to that story we brought you at the top of this newscast, a coronavirus briefing right now from Governor Greg Abbott in Beaumont. Let's listen in.
Brannick, Mayor Becky Ames, Mayor Bartee, and Orange County Judge Gathia, as well as I do want to emphasize my gratitude to a couple of categories of people. I want to express the gratitude that I and everybody up here share for all the nurses and the doctors, those who are on the front lines of responding to the challenges posed by COVID-19, as well as the law enforcement officers who literally put their lives on the line. And unfortunately, there was another one lost just yesterday because of exposure to COVID-19. We need to embrace and support everyone who has stepped up to help their communities respond to COVID-19. I learned a lot about what's going on in this region. First, in general, the region and especially the residents who live here are to be applauded for the way that they have collectively responded to the challenge of COVID-19. As everyone knows, there was a spike or substantial increase in the number of people who were testing positive, the hospitalizations, the people in ICUs, and unfortunately, an increase in the number of fatalities because of people losing their lives to COVID-19. In response, generally the people across this region, as well as across the state of Texas, have embraced the necessity to make sure that they have better practices that reduce the spread of COVID-19, such as wearing a mask, such as maintaining your distance from others, such as staying at home if at all possible, especially for those who are age 65 and older, who are the most vulnerable to contracting COVID-19 as well as losing their life to COVID-19. I was very impressed to learn some of the strategies that were being used in this region to reduce fatalities, to heal patients faster and get them out of the hospital room. I was particularly impressed by the use of blood plasma in the region. So important for everybody to understand this, because everybody who has tested positive for COVID-19 who has recovered, which is a very large number, both in Jefferson County, Orange County, as well as the state of Texas. But everyone who's tested positive for COVID-19 has recovered. They have blood plasma that can help others overcome the challenge of COVID-19. Many of those people have already been treated and recovered here in Jefferson County. If anybody in the region has been positive for COVID-19 and has recovered, we urge you to provide your blood through a local agency. Also, through the use of remdesivir as well as steroid treatments, the medical leaders in the region have been able to reduce the length of stay in hospitals, as well as to reduce the number of people who otherwise would have lost their life because of COVID-19. So the numbers are moving in the right direction, but it is fair to say that hospital capacity by those who are positive for COVID-19 still remains too high. And so one of our collective goals here today is to continue to work on strategies to reduce the number of people who are hospitalized in the Jefferson County region because of COVID-19. Now, part of that strategy are these medications, but the lead strategy is this, and that is the way to reduce hospitalizations is to reduce the number of people who test positive. As a result, I want to double down on the necessity of emphasizing one key point, the most important thing I could convey today, and that is, even though the numbers of COVID-19 have improved, COVID-19 has not left Jefferson County, it's not left Orange County, it's not left the state of Texas. COVID-19 still spreads across this region and across the country just as fast as it did in July, when you hit high numbers in deaths, high numbers in hospitalizations. And the only way to reduce the spread is by everyone continuing to do the best practices of wearing a mask, keeping your distance from others, staying at home if at all possible, using frequent hand sanitizing to make sure that you are reducing the spread of COVID-19. I'm pleased to hear that all of the needs are currently being met for the needs of the local governments to respond to COVID-19. I want to thank Chief Nim Kidd, the chief of the Texas Division of Emergency Management, who is here with us today, for all that he has done to help meet those needs. As Judge Brannick knows, I would call him on occasion over the past month or two whenever I would see the numbers increase in Jefferson County, and every single time that I called him, he responded with the same sense of calm resolve, helping me understand that he and the leaders in Jefferson County were fully on top of the situation. They knew exactly what they needed to do to try to move the needle, to make sure that they would be able to reduce the spread of COVID-19, to make sure they would be able to reduce the number of people who were hospitalized, and that's exactly what they have been able to achieve here. So I applaud the local leadership and their collective response to the challenge posed by COVID-19. Now, one thing that we all know, and that is that schools are opening and will continue to open over the coming days and weeks. And they're opening in different ways because the way that they are opening is based upon decisions made by local school boards as well as local school districts, knowing that those local school districts will know what is the best solution for that particular district. Some will be opening up in person, others will be opening up remotely. Some may continue remote education all the way until time periods in October. And whatever is the best determined strategy by a school district.
You are listening to Texas Governor Greg Abbott talking about the impacts of COVID-19 on Jefferson and Orange counties. He is speaking from Beaumont this afternoon. We will continue streaming this for you on click2houston.com.